Heart attack, the greatest imposter. Today we're diving into a special topic that could save lives, the diverse faces of a heart attack. This isn't just a video, it's a lifeline, and you won't want to miss a beat. Dearest viewers, our greatest enemy, the heart attack, is also the greatest imposter. It has many faces, and knowing them all is extremely important to identify it correctly. Any mistaken diagnosis can mean instant death, so please watch till the very end so as not to miss any of the different faces of this disease. Severe chest pain. Meet Mr. John, who is a 60-year-old fellow, having hypertension. One fateful morning, he enjoys a hearty breakfast and sets out on an uphill walk to meet his friend. Suddenly, he is gripped by the most excruciating chest pain ever felt. He is drenched in sweat and starts fainting. This is acute myocardial infarction. Anybody's nightmare. Pain in other body areas and not in the chest. Heart attacks are not always a pain in the chest. Now meet another person, Mr. Smith, 68, who felt a peculiar discomfort in his neck and jaw, which soon moved to his shoulders. He had nausea and vomiting. His heart was pounding and his face was wet with cold sweat. An ECG confirmed that this also was a heart attack. Please note that he doesn't have that chest pain. His pain is rather in his neck, jaw, and shoulders. So the lesson is that it is not necessary to always have chest pain with a heart attack. Silent heart attack. In contrast to what we just saw with Mr. John and Mr. Smith, there is another person, Sarah, who suffers from a long-standing diabetes. One fateful morning, she was quite all right standing in her room when she suddenly fell on the floor and was found dead. On post-mortem examination, she was diagnosed to have died from a heart attack. Those who suffer from a silent heart attack rarely reach a hospital. Women and those with diabetes, mellitus, are more likely to have a silent acute myocardial infarction. Indigestion. Next, meet Mr. Brown, a 70-year-old man with his own set of problems like obesity, hypertension, and frequent tummy problems dismissed as indigestion. One day, after his favorite meal, the most unwanted happened. He was severely breathless and his heart was racing. He could no longer stand and soon collapsed. An ECG in the hospital revealed Mr. Brown also had a heart attack. So viewers, a heart attack can also mimic indigestion, tummy aches, and abdominal discomfort. The frequent tummy problems of lesser severity in his past were found to be bouts of angina. These stories are just the tip of the iceberg. Almost every case of acute myocardial infarction is in some way different from that of another patient. So much was about the different faces of a heart attack. In the coming videos, we will talk about how to prevent this nightmare and how to respond if anything like this ever happens to us. Subscribe and stay tuned to unravel more secrets that can make a difference. Stay vigilant, stay informed. Never let a patient go unnoticed. Saving one human life is like saving the whole of humanity.